There are some contraindications to these services, of course, like with anything done into the skin. There are certain people who cannot have it done or need medical clearance. One of those people are those with diabetes or cancer survivors or those going through cancer or radiation or chemotherapy. So with diabetics, whether you're pre-diabetic or whether you are diabetic, I'm not going to pretend to know the different types of diabetes, but just know that if you are a diabetic, we require that you go to your medical provider, get a note from them releasing you and giving you consent to have a tattoo done on your face. The reason why this is because in general, now I know it doesn't go for every single diabetic type, but in general, diabetics do have issues healing, and because the healing time is an average of 2 weeks, if it's prolonged, it could cause infections and certain issues that we just don't want the client to have to go through. Those who are going through cancer or are cancer survivors, if you are going through chemo right now or radiation, we require that you wait till your last treatment, 6 months from your last treatment, in order to be able to do a service like this. If you are within those 6 months, then we require that you have a doctor's note and releasing consent for you to have the service done, because of the fact that when you're going through radiation or chemo, your immune system is a little lowered and less strong. We don't want you to have catch an infection or something and then your body can't fight it and it becomes a bigger issue. For women who are pregnant or nursing, you cannot have this done because of the fact that anything that goes into your body goes into your baby, whether you are feeding the child or whether you are feeding him through your body. Anything that you consume, anything that you put on yourself will go into the child. That's why women cannot have certain massages. They can't even do certain facials. They can't have their certain nail services done. So these are all services that you cannot have done where you're pregnant. So imagine, it's definitely not a tattoo. So please just know that we cannot work on pregnant or nursing mothers ever. Also, other skin conditions that we cannot work on are those with who have seborrheic dermatitis, because seborrheic dermatitis causes a lot of the flaking of the skin, and it's brought on by stress, and this is a service that can be a little stressful on the skin, and sometimes some clients who suffer from these conditions will have a flare-up, and if their skin is scabbing or flaking too much, it will peel off and take off all the pigment, and then the client will be unsatisfied because it all fell off. When it's not our fault, it's their skin because it was stressed by the service. Also, those who have severe acne in their eyebrow area, we cannot go over because acne is bacteria, and if we go over that area and the bacteria spreads, it could actually cause more acne to appear on this person's face, and we don't want that to happen either. Those who are taking certain medications like blood thinners and certain medications that for the heart and heart health, we suggest that you check with your medical provider and make sure that you are okay to have a tattoo done, and that you explain to them that we are using a numbing that has epinephrine, because epinephrine is known to sometimes cause heart acceleration and can be an issue. So just be sure, if you have any certain conditions that you think it may pose a complication or a contraindication to the service, please feel free to ask your medical provider and to get clearance from them, because we are not medical providers, so we can only go by our experiences. We cannot tell you for certain whether or not you can or cannot have this done.